Matters, and hello. Thanks for being there. I am Mary Alale Yusuf. Every year, about 17 million people die from cardiovascular diseases, of which strokes are a part. Yet the World Health Organization says 80% of these cases can be prevented. A stroke or cerebrovascular accident occurs when a blood vessel in the brain ruptures and bleeds, or when there's a blockage in the blood supply to the brain, preventing blood and oxygen from reaching the brain's tissues. According to the World Health Organization, globally, strokes are the second leading cause of death, the third leading cause of disability, and a major reason for dementia and depression. In the last 4 decades, the stroke incidence in low and middle income countries has more than doubled, but declined by 42% in high income countries. My guest is a consultant cardiologist and chief medical director of United Heart Hospital and Clinics, Dr. Eugene Musu. You're welcome to the program, sir.
Thank you very much for having me.
Let's quickly find out, why are the blood vessels rupturing or blocking, first of all?
Yes, let me do this, okay? Let's define the problem. And I'm going to give you a simple presentation that happens time and time again in this country, because it should not be. Stroke is preventable, stroke is beatable, and stroke is treatable. Just not too long ago, right here in my office at United Hearts in Victoria Land, I saw a patient that was brought on a wheelchair by the son, just 53 years old, could not talk, could not move, and paralyzed. And the problem is that he has had high blood pressure for 10 years, took medications for just a few months, and he stopped taking the medication. And all was well with him.
High blood pressure is
high blood pressure is silent killer, no symptoms. And suddenly he woke up one morning, mouth twisted, face droop, drilling saliva.
In that condition, all
at once, without warning. It's like a volcanic eruption. And then what happened? He's paralyzed. Guess what? His life has changed. And he's now a burden to his family members and caretakers. So stroke is real. And because you don't have symptoms, all is not well. So let's go back to what is the cause of stroke and what is blockage. You have, in your introduction, you very beautifully outlined the statistics and strokes and what causes stroke. There are 2 types of stroke. One is ischemic stroke, which is caused by blockage of plaque to a blood vessel supplying an area of the brain. And the second one is hemorrhagic stroke, which is bleeding.
Rupture.
Okay, rupture. Ischemic is the most common. It is 87% of cases. The hemorrhagic or the bleed is 13%.
Okay.
2 causes of ischemic stroke. One is a blood clot. When you have a rupture of the buildup, fatty buildup in the artery of the brain called a plaque, it causes a blood clot to form at that site and blocks the blood supply. The second one is embolic stroke. When you have particles, it could be blood, it could be fatty particles from the aorta, the major vessel, or it could be from the heart, from atrial fibrillation that travels to the heart and lodges and blocks a small vessel in that area of the brain, cutting off the blood supply.
Therefore starving the brain.
Absolutely. That is your embolic stroke. Okay. Now, the second one is hemorrhagic. When you have a burst or leaking blood vessels, usually from what you call aneurysm. Aneurysm is a weakness in an area of a spot in the blood vessel that balloons out and is prone to rupture very easily.
That could be caused by diabetes.
That could be caused by high blood pressure, uncontrolled hypertension. Diabetes is also a well-known cause of that. And the second cause of the bleeding or hemorrhagic stroke is AVM, arteriovenous malformation. This is abnormal blood vessels formation in areas of the brain.
That cannot be controlled, can it?
Well, there are several things that can cause it. Those ones are usually more difficult to treat. Okay, so these are the types. Now, when it comes to the risk factors for stroke,
Tell us about the modifiable ones first.
Oh, wait a minute. Most of them are modifiable.
Most of them.
I am telling you, 80% of stroke is preventable by lifestyle changes and control of, treatable things. The first one that we should know in this country is hypertension. Hypertension is a black disease. It's a black disease. It's more common in we Africans. Our genes retain a lot of salt, okay? And we are salt sensitive. Hypertension is very common, and it's a silent killer, okay? Simply knowing your blood pressure and changing your lifestyle, not just medication. Changing your lifestyle, what you eat and exercise can actually decrease your blood pressure, making it easier for medications to control. But here, most of us physicians are quick to write prescription without emphasizing spending more time on lifestyle change, because that's where the money is. Okay, so hypertension.
So with a lifestyle change, would it be possible to just do without drugs?
Not quite. For mild hypertension, yes. Okay, if your hypertension is not severe, lifestyle changes may be all you need. But if you have severe hypertension, lifestyle change is important, because it will decrease the number of medications you need to control the blood pressure. From clinical trials done on several thousand people, for people with hypertension, it takes an average of 3 to 4 medications to control your blood pressure.
Wow.
So lifestyle change can decrease the number of medication you are taking to 1 or 2, at most 3. Now, the second one about risk factor, which is modifiable, is diabetes. Your diabetes needs to be controlled. In my practice at United Heart, seeing patients, there are people that are diabetic coming to me and their A1C is 11. And
what's an A1C?
A1C is a blood test. It's glycosylated hemoglobin. It's a blood test that can actually give you